When you know that you have the most contagious variant to date, it means we have to double down on our efforts to getting people vaccinated. Getting vaccinated now is more important than it's ever been.
Dr. Todd Ellerin has been a familiar face and a trusted voice throughout the pandemic. As director of infectious diseases at South Shore Health, he's been watching the vaccination rates and their impact very carefully. And with Delta in mind, Dr. Ellerin says there are 3 things you should know right now about the COVID vaccine.
It's extremely effective in saving lives. It's safe both in the short term and the long term, and it reduces transmission mostly because it prevents infection in the first place, or reduces the likelihood of infection.
Dr. Ellerin says all of this is taking on added importance since the CDC says Delta is nearly twice as contagious as previous variants and may cause more severe illness. Even with the surge, there are still a lot of myths and misconceptions about the vaccine. One of those myths and misconceptions doctors say is if you've already had COVID-19, you don't need to get a shot.
Getting COVID-19 certainly leads to an immune response, and that's a good thing. The vaccine actually increases the number of antibodies far greater than natural infection does. Those are the antibodies that actually stop the virus from entering the cell. We think that's really important.
Another myth that doctors say has been a constant since the rollout started, that getting the vaccine could have an impact on fertility. Dr. Ellerin says the science on this is very clear.
There's no other way of saying it. This is just a pure myth. It's disinformation, not misinformation. It's just not true. There's no scientific basis for it. In fact, let me give some examples in my own system where I'm working with people, some of whom are actually going through treatment for infertility, and more than one of them have gotten pregnant within weeks of getting their second dose of the vaccine. Now, again, that's not science, but ultimately, the studies will show that the COVID vaccine in no way, shape, or form affects your likelihood of getting pregnant.
And finally, a myth that doctors say is becoming increasingly dangerous during the Delta surge, that once you've gotten vaccinated, you no longer need to take any precautions.
Certainly, that was the hope, that once we got vaccinated, we'd be able to just rip off our masks and life would be back to normal. And when you think about the Provincetown or the P-Town outbreak that we just learned about, where there were, hundreds and hundreds of people infected, and most of those people who were infected were fully vaccinated, that's one of the reasons why the CDC recently changed their guidance and were saying that if you live in a warm or hot zone across the country, that whether you're vaccinated or unvaccinated, it's wise to wear a mask when you go indoors.
Now, we should mention that Dr. Ellerin also added that the Provincetown outbreak provided another critical lesson on the importance of vaccination. He says close to 1,000 people were infected, most of them vaccinated, and very few were hospitalized, and there were no reports of any deaths.